How are you guys doing? Okay, so today's video, this will be your how to drop medication, whether it's testosterone, your skinny girl injection, Semaglutide, Tirzepatide. When you get this in the mail, they come sterile, right? So I'm going to use a couple of different bottles just to show you what we're looking at. But the most important thing is that you keep your vials sterile and that you're trying to maintain a very, very sterile environment while you're drawing up. But when you get your vials of medicine, no matter what they are, they typically are going to have this little metal cap, and your job is to pull this little centerpiece off. It's kind of perforated already, and so you just kind of pop that off. And any vial that you see, there's a little rubber stopper in the middle, and they all have a bullseye in it. So the bullseye, that's where your needle's going to go, right in the middle of that. So important when you draw your medication up, know what you're taking, know how much you're supposed to have, and then you make sure you're clean. Your hands are washed, or your gloves, whatever. I don't care if you just pull that off or not. You're going to always wipe the top of your vial with alcohol pad. So I like to scrub mine first, and then I'm going to do two here at one time because I want you to see the differences. And then let them dry for a second while I get my needle ready. So if I'm drawing up Semaglutide, Tirzepatide, that's a sub-Q injection, which goes just very into the surface. You're going to pull, all syringes are new. When they look like that, they'll have a little cap, your sub-Q syringes. You pull that off. Know the dosage, so I know what dosage I'm pulling up in here. You pull off your cap. You pop your bottle up. So I like to have the vial where I can hold it, and I kind of direct it with my thumb straight into the bullseye. You flip it upside down. Make sure you can see the fluid. So don't worry about pushing air in it, not pushing air in it. You just want to make sure that you can see the medication going into the syringe. Once you get some in there, push it back up to the dose that you're supposed to be giving, and then you're going to flip it upside down, pull your syringe out. You're done with that. That's it. You put it back in the container, put it back in the fridge, don't touch it again. This doesn't touch anything. It's going to sit on the side of a table to ensure that we don't contaminate anything. So if I'm drawing up an IM syringe, maybe it's testosterone or a skinny girl syringe, that's going to look like this. They come in little containers usually, or little plastic things. You just pop it out. You want to make sure always, so here's a problem with the bigger syringes. The needles, when they package them on there, sometimes they're not on very tight. You can use a separate needle to draw it up. That's up to you. My testosterone guys like to do that. But you just tighten it down before you pull this off. Remember, I wiped that with alcohol first, using my thumb to guide me straight into the bullseye, upside down. I'm going to pull my medication out to make sure that I have 1 cc in there. Once I know that that's what I've got in there, I'm going to pull it out, ready to go. Easy peasy. If you ever have any questions, you're going to make sure you call us. But the most important thing about drawing your medication up is that it stays sterile, and that every single time, say I messed up my medicine, I don't re-stick that bottle with the same syringe. I don't care if it was sterile the whole time. You risk putting bacteria in here, and that's where people get sick. They don't know that they're growing bacteria in it, even after they put it in the fridge, and then they inject it, and then they put something in them. So take this part serious, and always really scrub it with alcohol and your hands. Make sure you stay clean. And that's it for this video. Thank you.